An enlarged prostate causes a lot of guys with urinary difficulties. In the United States alone, about 40 million men suffer with an enlarged prostate and urinary symptoms. Jerry is one of these brave guys who actually took action and had a procedure done several months ago. And he is going to share his journey regarding his enlarged prostate. Now, Jerry, you're 69 years young. When you first came into the office, you were taking a medication to help you with your urination. What was
Yes.
that like?
That medication I had to take every day, and it got to the point where I had to take two a day because even then it was very difficult for me to urinate and empty my bladder completely. It just felt like I had to be close to, I had to know where all the restrooms were at.
That is so common for a lot of my patients. So you took initially one medication, one tablet a day or capsule a day, and then you started taking it two a day.
That's
And
correct.
then what happened?
Well, it got to a point where I, I needed to see a urologist. My wife suggested, well, let's go here where we're nearby anyway. Um, so I came to you, and you did all the tests and what have you.
What kind of testing did you undergo?
Well, you tested to see how much I was emptying my bladder for one, uh, and
And then
so
we took a look inside the prostate and the bladder.
that's correct. And you saw that I had an enlarged prostate, and that's what was cutting off the circulation, or I mean, rather the flow
Mm-hmm.
of the urine out of the bladder.
Mm-hmm.
And so you suggested different things. I think you even mentioned Urolift, which today I asked you between the two, what was the better, and you gave me that answer. And what I had done was the TURP.
Yeah. And because you are not a good candidate for UroLift, even though there's a lot of enthusiasm for guys who want to have UroLift, not everyone's a candidate. And I always try to guide you to a procedure that is going to cure you and that is also going to give you the longest lasting results.
Correct. And so after having that procedure done, as scared as I was to have it done, had to go through that surgery, and it was you know for one day, I guess, very. Uh, I didn't know if I regretted it because I had it's a scary procedure to me. I never had surgery before, but afterwards, I have not regretted it a day. Not one day has gone by that I regretted it.
Okay, so you had the evaluation and then you finally decided, okay, this TURP procedure is the right procedure for you. You had the procedure. Now,
Yes.
tell us a little bit more detail about that procedure. Did you have to stay overnight in the hospital and also
Oh,
talk to us about the catheter, which is a big issue for a lot of guys. They're afraid of the catheter.
right, and understandably, I wouldn't request it just because,
Sure.
but it was necessary. But the procedure itself was done at a surgical center.
Mm-hmm.
It was outpatient, and I was able to go home that same day. Of course, I went home with the catheter.
Mm-hmm.
Still, I had to get through that one night, and then come back the following day, and I had it removed.
Mm-hmm.
And just like any surgery, you feel a little pain, or get a little nervous, but not that I've had any, but I know people go through it.
Mm-hmm.
And so anyway, I I went through that, and after it was removed the next day, uh, it slowly healed on the inside. I would have a little blood, when I urinated, but I was able to urinate. Now, initially, it wasn't like the easy flow right away because you have all this other stuff that has to come out, some of the
Scar tissue.
scar
Yeah,
tissue
yeah.
that you had mentioned, yeah. And sure enough, it did come out. I could see it. But slowly, it started healing, and I drive quite a long time now without even having to urinate. And before I would go maybe an hour, and I was looking for a place to stop.
Wow. So it sounds like you had an outpatient procedure, meaning you went home the same day after surgery, and you had the tube draining your bladder for less than 24 hours. Am I right?
That's correct. That's correct. I'd recommend that procedure to any of you guys that are having difficulty and don't want to take pills or are tired of taking pills. Have that procedure done. It's well worth it. I guarantee it. I do not regret it, not one day.
Well, thank you so much, Jerry, for sharing your story.
Oh, you're welcome. Thank you for recommending it to me.
You bet. May I share this video with those who may be interested?
Sure, of course. I would love to have others, listen to my testimony on that procedure because, like I said, I don't regret it. I don't think you will either.
All right. Thank you so much.
You're welcome. Thank you, Doc.